Are you ready to see an immediately loaded implant denture case? I've got a beautiful case for you. We'll show you before, from the start, and the finish, the after, and how it transformed Mrs. Jones's smile. We'll also show you what went wrong in the process and how we fixed it. Let's jump in. So Mrs. Jones came to us, and you can see the state of her mouth. She'd been a patient actually with us for several years, and you can tell a lot of these teeth actually are already crowns, and she's had trouble her entire life with mostly tooth decay. She wanted an aesthetic improvement, and we said, you know what, Mrs. Jones, it's been one thing after another for you, and we can improve the aesthetics all in one foul swoop, and probably it's the last dentistry she's ever going to need. And she was interested, so we talked through these options, but ultimately we landed on pulling out all of her existing teeth, placing implants, and allowing the implants to support a denture, both on the top and the bottom. So here's how Mrs. Jones started. You can see her smile line here, and then zoomed out, you can see her facial smile. And so when we design smiles at Teuscher Legacy Dental as cosmetic dentists, we're always trying to put the teeth in an ideal position in your face, right? Because your smile is about more than just your teeth, and we don't want to get too hyper focused there, but we want to recognize the whole face, the whole smile. And so this is where we start. And, one of the first things we notice about her smile, in addition to color and shade, is that there's kind of a downward slant to her right side. And so you can see that even in this photo, you can see this downward slant. Now, you'd be able to tell a little easier if her eyes were there. But she has what we call an occlusal cant. So it's just tilted down a little bit. So that was something we knew we'd need to address. The day of surgery, everything went as planned, I should say. Everything went really well. Mrs. Jones had her surgery at Midwest Dental Implantology here in St. Charles. And this is just an x-ray after the surgery. So you can see all the teeth came out. You can see 6 implants on the top, 4 on the bottom, and then the temporary prosthesis, the temporary dentures, immediately placed on the top and the bottom. Now, this is one day after her surgery, and what you'll notice is Mrs. Jones, first of all, there's a little bit of bruising from the surgery. That's normal. It's just one day afterwards. And the aesthetics are already much improved. What we see when we zoom in, though, is that her bite is actually a little bit open, especially on the right side. And this is exactly where we elevated that right side so that there wasn't such a cant on her occlusal plane. But now it's created an open bite, which we don't want her to live with for her entire healing period. The trick with immediately loaded implant dentures is even with the digital planning technology we use, still when we put the dentures in the mouth and there's swelling, there's surgical healing happening, sometimes things don't fit 100% perfectly. And so we need to address it, but it's kind of something we expect. And so what we did is, this was one day after her surgery, and that same day we took new impressions and gave instructions to the laboratory, Ottawa Dental Laboratory is who we used, to improve this bite relationship. I don't think I have a great photo of the temporary she wore for the next 6 months as her gums and bone around the implants all healed. But it's a very important step for the gums and bones to heal around the implants before we put the final denture on. Because what happens is, there's swelling, and over the course of 6 months, the bone will change shape, dimensions just a little bit, but enough that it can cause a less than ideal fit at the end of the 6 months in the final denture. And we really want the final denture to be absolutely perfect. And you'll see how we make sure that's the case. So this is actually after 6 months. We decided to broaden Mrs. Jones's smile and improve the shade a little bit, make it even a little bit brighter. Now, the shade, as we'll talk about in a minute, is too bright right now. But what I want you to focus on is how wide and broad her smile is. It creates a much more youthful appearance, both of the teeth, but then I'm showing you her face too, because when the smile fills the cheeks more, it decreases wrinkle lines and allows for a more youthful appearance. And that's what we're really going for with Mrs. Jones. So this is what we call the test drive phase. So Mrs. Jones is test driving her new bite and smile relationship. Now, as it turns out, this is too bright, and we all agreed on that. And so what we did, because we noticed it was too bright, is we made a custom shade by staining and glazing over the dentures that day in our office. So we took the photos, we knew they were too bright, and that same day, took about 10 minutes, we added this customized stain. Now, not everybody can do this, not everybody's going to be willing to do this, but as cosmetic dentists, this is right in our wheelhouse. So it was easy for us to take care of Mrs. Jones in this way. And you can see our standardized shade tab. B1 is a very bright shade as it is, and you can see her teeth are, well, her temporary try-in teeth were much brighter even than the B1. And so you can see after the custom stain and glaze we did, it's much closer to B1, so still a bright and very pretty youthful appearing shade, but not one that will stand out and be awkward in pictures or have her friends thinking, when did you put chiclets on your teeth? And so actually Mrs. Jones told us this test drive phase, it photographed really well. She felt more confident smiling and even chatting with her friends. So we knew that the size and position of the teeth was ideal from the test drive. We also knew she liked the shade because of how we adjusted it. This is Mrs. Jones's final delivery day. So this is about 6 months and 2 weeks, almost 7 months after the initial day of surgery. Now she's had teeth the entire time, but the 6 months allowed for perfect healing of the gums and bones surrounding the implants, and all the swelling's gone away. So she's at a point of stability where we can make something that's going to fit for her long term. We also were able to test drive the aesthetics of both the shade and her new smile architecture. Remember, we broadened her smile and even elevated it a little bit, made it a longer smile, because as you age, your smile tends to collapse a little bit. So if you think of grandma without a denture and her jaws kind of collapse, and she's got a lisp and everything. And so in any case, Mrs. Jones looks like she's 20 again with respect to her smile. And you can even tell in these full face photos how confident she feels about herself, right? You can see in this photo, right? That's a confident, genuine smile. And this zirconia, this rosin technique with the beautiful zirconia over the titanium bar, really created a lifelike appearance. And I'll show you a couple other before and afters here. So in this before and after, you can see the teeth, how they were when Mrs. Jones came in, or at least when we had this initial conversation about doing these implant supported dentures, and then how it turned out for her. And so you can tell, again, we broadened her smile. You can see the cheeks are filled out even better. Obviously, we improved the shade, made everything consistent. And you can tell she's got more teeth to chew with. She's going to be able to chew better, longer. And, one of the problems with aging and losing teeth is actually losing ability to chew. As you lose ability to chew, you're going to intake less good nutrition. And obviously, the less nutritional value is going to impact the rest of your health and well-being. So this is a big deal, not only from a cosmetic standpoint and just a comfort standpoint, but even from a systemic health standpoint. This was a huge improvement for Mrs. Jones. And then finally, I love this because you can see Mrs. Jones' full face smile from the start and then how she finished. And, not only is the smile much more genuine and, the teeth are by far more beautiful, but if you kind of notice some subtleties here, you can see Mrs. Jones came in this day and, she maybe didn't do her hair, but here you can see her hair is all done. She's wearing makeup here. I don't know if you can tell because her eyes are covered, but the point is it's not just the teeth that transformed. It's Mrs. Jones' whole idea of herself, a new confidence and a brand new demeanor. She talked about how her friends, recognize this and tell her, she's a whole new person. And that's really meaningful for us, right? Because we can help people with teeth. That's awesome. But this is truly a life change. And it's an investment, yes, but it's an investment that you want to make with confidence, right? And that's why the test drive stage for us is so important. That's why the ability to custom change the shades for Mrs. Jones from too bright to just right made all the difference for her. She would tell you she doesn't even notice that she has dentures. They just feel like her natural teeth. And that's exactly what we want. If you have questions or want to learn more, I've written more about this case. And if you're thinking about implant supported dentures, come chat with us. We have helped people like this all the time. I'll continue to post more resources for you, but we'd love to help you. Thanks.